Thank you so much for joining us today as we discuss the HIV rapid test OraQuick. In 2015, 39,513 people were diagnosed with HIV infection in the United States. The number of new HIV diagnoses fell 19% from 2005 to 2014 because HIV testing has remained stable or increased in recent years. The decrease may be due to targeted HIV prevention efforts. However, progress has been uneven, and diagnoses have increased among a few groups. Gays and bisexual men are the population most affected by HIV. The number of new HIV diagnoses fell 19% from 2005 to 2014. African Americans accounted for 45% of HIV diagnoses, and Hispanics and Latinos accounted for 24% of diagnoses. This table shows how new HIV diagnoses in the U.S. were most affected by subpopulations. Black men who have had sex with men have the highest rate, followed by white men who have sex with men. Jackson, Mississippi ranks fourth of all major metropolitan areas with a rate of infection per 100,000 people. According to CDC data, 50,000 people acquire HIV each year. And according to Emory University, 4 out of every gay or bisexual men in Jackson have HIV. HIV was first discussed in the Morbidity and Mortality Weekly Report published in 1981. Case reports showed that the symptoms of a disease was prevalent in homosexual men who resided in California and New York, as well as intravenous drug users, hemophiliacs, female partners of infected men. In 1984, the retrovirus was isolated as the agent, and the disease was named Human Immunodeficiency Virus, HIV. Early trials of antiviral treatments for HIV did not meet success. In 1987, Zidovudin, or azidomycin, became the first drug approved by the FDA for the treatment of AIDS. Early excitement over the life-extending effects of the drug soon met disappointment, as patients treated with this one drug therapy began to experience disease progression, which in most cases led to death. Protease inhibitors were introduced in the 1990s. Combined with antiviral therapy, mortality and morbidity associated with HIV declined. HIV screening determines whether a person is infected with the HIV virus. Some tests check for antibodies that the immune system produces in reaction to HIV, and some tests look for the virus itself. Testing is recommended because it slows the progression of HIV and can also lead to earlier treatment for someone who doesn't suspect that they have HIV. OraQuick detects the cells that the body's immune system has created in response to HIV infection. When HIV is in the body, antibodies are produced to fight the infection. The presence of these determines whether an individual has HIV. Knowing your HIV status provides information on how to keep yourself and your sexual partner healthy. Because of its position in the American market, its effectiveness has been more widely examined than other rapid devices. Some problems included false positive results and limited sensitivity in people with recent infection have been identified. More problems have occurred when the test is used with oral fluid, saliva, than when used with the finger prick blood, venipuncture blood, plasma, or serum. The CDC reported on their experience of using OraQuick in 2 separate reports in 2006. The 4 studies pooled data from over 12,000 people. Post-marketing surveillance tracked the use of OraQuick with over 160,000 people, and both papers suggested that their experience of using OraQuick was broadly consistent with the manufacturer's trial date. A few of the ethical concerns that may be faced is that the test does not require mandatory counseling, since it can be purchased and taken within the home. If someone tests positive for HIV, then they are not receiving counseling immediately following and may not act on the discovery of this news. Secondly, the test isn't 100% effective and can give false positives to people that take it. Lastly, coercive testing may occur. Individuals may be coerced to take the test instead of taking it on their own. For these reasons, we believe that OraQuick should be used here at the Jackson, Mississippi Department of Health, and we will be doing a study using OraQuick.